Good evening, everyone, and welcome to the AskDrMJ. Why? Because your health is important. Facebook Live, Instagram Live, YouTube Live, the only interactive healthcare forum that allows you, the listener, to call in and ask your healthcare questions. So we are live here in the studios, and we want to thank you for joining us this evening as we go from the window to the wall. Y'all all know that song. That always gets the party started. We like that song. All right. So thank you for indulging me with that. And I like that song. I thought it'd be a good way to get a lot of energy for the evening's program. So thank you for joining us. We know that you have lots of options and things you could be doing, but you've chosen to spend this time with me, and I'm going to try to provide to you infotainment, information that is entertaining. I only have one request of you. Don't keep this information to yourself. I want you to share it with your friends, your family, your loved ones. When you gather as a group, you playing cards, you watching the game, have conversation about whatever, but also bring up a few of the topics that you hear tonight. One thing that I can state unequivocally, the information that you're getting here tonight is real, is 100% accurate, and it is something that you can share with authority and enthusiasm. So much better than the usual beauty shop, barber shop. I saw it on the internet. Somebody said, I heard, a word on the street is. You getting the real deal here, 100% pure, clear medical information that you can take to your friends and family and share with them. Why? Because your health is important. We want you to be a medical consultant. We want you to be the person that people can go to when they want real information, and then refer them also to this broadcast, the Ask Dr. MJ broadcast, which airs at 6:30 p.m. Eastern Standard Time, and we are here live in the studios. We have Highly Guy producer and call screener who will be screening and answering your calls and putting your questions up. So Highly, let's do our usual roll call. Let's see who we have with us this evening. Cindy here from Fort Worth, Texas. Hi, Cindy. It's a pleasure to have you back once again. I love that picture that you have there. You're on Facebook. Thank you very much. No, you're on YouTube. Linda Bloomer, also on YouTube from Birmingham, Alabama. Bright Light City. We loving that. Mayor from Morehouse College. We love it. Lynn F. from St. Louis. St. Louis is in the house. We have the Midwest well represented. Lynn, you are a regular at this point. Joviality. Dimitri Benjamin from Cleveland, Ohio. Cleveland, that is the hometown of a lot of my good friends. I have family in Cleveland as well. Okay, Gwendolyn Lindsay. Hello from Cincinnati, Ohio. Hi, Gwendolyn. So glad to have you here as well. Okay, Mimi Witcher. Good evening, Mimi from Atlanta/Tampa, Florida. She commutes and she goes both ways. She's living and enjoying life. Glenda Everett. Good evening from Warner Robins. Hi, Glenda. Glad to have you and Warner Robins in the house. Patrick White, good evening, family. One love, Patrick. So glad to have you joining us as well. I love all the men that listen because we want to make sure that you're sharing this information. Kathy Kenny, hello, Kathy from Arlington, Texas. Arlington, we love Texas. I hope it's not getting too hot there yet. Denisha from Kansas City, Missouri, home of the Chiefs. Yes, the Super Bowl winning Chiefs. We love the Kansas City. I'm sorry they didn't put it off this year, but we expect great things from Patrick Mahomes next year. Okay. Love Jones. But that's great. I love that, Love Jones. From St. Louis, Missouri. Thank you for tuning in as well. T. Carter from Birmingham, Alabama. Tabitha here. Hi, Tabitha. Thank you for joining us. We appreciate you. Okay. Arnita Juden from Mississippi. Mississippi in the house. Now, we've covered the South. We want to see who we got from New York, New Jersey. Who do we have from California, LA? Vicky Bragg from Duval. Hi, Vicky. So glad to have you here. We know how to say it. that coach down there didn't know how to say it. Good afternoon from Baton Rouge. I see Turner. You know Baton Rouge is one of my favorite places. We love Baton Rouge. Valerie Williams, good evening from the Chi. Chicago is in the house. We love Chicago again, Midwest. Okay, Benita Peasley from Duval. We got Duval followers. That is so glad. I'm so glad that Duval is in the house. Thank you so much for joining us. We appreciate that. So I'll pick up from what I started this morning on Wellness Wednesday on the Rickey Smiley Morning Show. We talked about our winter lull. Most of us have been hibernating over the wintertime, doing as much nothing as possible. I think that our culture has changed because before we were a little more active, but now, we have the options of Netflix and chilling and binge watching shows. And before you know it, we've been sitting around sleeping, eating, watching television, and first that's Friday night, then there's Saturday, then there's Sunday. Before you know it, the entire weekend is going by, and then you've not been that active. Well, now the days are longer. It's not getting dark until 9 p.m. So you have a little extra time. And most of us are starting to get out and try to do things. But you've been hibernating. Your body is not ready to do those things. You have to ease into it. We cannot just jump out of our car and go straight to the tee box for our tee time on the golf course. We can't jump out of our car and go straight to the basketball court and play half-court basketball or even full-court basketball, which none of you should be doing. But there are people that are out there doing it. We cannot just jump out of our car and go play tennis or pickleball or anything. We have to warm up. We have to warm up, and we have to stretch. Why? Because those tendons, those muscles, those joints, those all the things that connect us, they become dry, they become brittle, they become fragile. And what we don't want to see are ruptured ACLs, PCLs, torn Achilles tendons, all those injuries that can affect us. Torn rotator cuffs, very common as we approach your 5th decade. So, and part of that is because we've not been using us, and then all of a sudden we put strain on it, we torque it, and it's not used to that kind of stress on it, and boom, pop, it pops. And before now, you got a surgical problem. So when we have recommitted to working out, going to the gym, or exercises in some form or fashion, we got to make sure that we do whatever is necessary to avoid musculoskeletal injuries. And so if we prepare ourselves for exercise appropriately, we can do that. One, make sure you get enough rest so that you're rested and not fatigued when you go to work out. Two, that you're hydrated. A lot of us, as we get to the 5th decade or older, we start to drink less water. We start to drink less liquid anything. Why? Because we don't want to have to get to the urge to go to the bathroom, and which will inhibit whatever we want to do. So we start drinking less, and over time, we start putting stress on our kidneys. That makes you susceptible to getting lightheaded and dizzy when working out. So you want to be well hydrated, not only before working out, but during working out and after working out as well. So before we start warming up, or before we start working out, warming up is key. We want to make sure we're doing that. So it may be something as simple as gardening. You hadn't thought about that as a workout. It could be hiking. It could be jogging. It could be running. But take at least 5 minutes to warm up. 10 minutes will be better. That prepares your muscle and your heart for this vigorous challenge that you're about to put on it. And then afterwards, make sure a proper cool down. That allows your body to re-obtain a normal status and stasis so that you're not susceptible to lightheaded, dizziness, or even chest pain, or problems where you're challenging your heart. So stretching is very important. Loosening yourself up, static stretching, where you're moving, stretching, moving through full range of motion slowly and gently. You want to stretch from head to toe, particularly the back. If you're playing golf in particular, golf is the absolute worst thing you can do to the human body. So a golf swing is horrible and it hurts the back. And that's why most golfers have problems with the neck and back. They have multiple ruptured discs. They can't have very long careers, and it is a problem. So we got to stretch before we do that. So it's very important that we do that. Wouldn't be a bad idea also to take anti-inflammatories, Motrin, Advil, or Aleve before working out. I take mine before I work out. I take it the night, sometime late in the evening after dinner before I go to bed, and I take it again in the morning so that I'm not sore, stiff, or feeling strained after working out. The more vigorous the workout, I may take it for a couple of days, but that will make a major difference in how you feel after working out and also during working out. Lastly, it was very popular one time for people to put on these rubber suits or these plastic suits, shirts and bottoms that would make you sweat, quote, to lose weight. All that does is dehydrate you, and that's bad enough for a person that's in their 20s. But for a person that's in their 50s or older, this is a real problem. Don't ever put on one of those suits, because you are just going to put a cardiovascular challenge on your heart that you may not have to deal with. If you know you have heart disease, diabetes, high cholesterol, or some other health challenge, go to your doctor, get a comprehensive physical examination, get yourself checked out before you start working out. And that way you get clearance that you can work out. We want you to get fit. We want you to get sexy. We want you to be the best that you can be, but we want you to do it the right way and maintain good health. So that was our spiel this morning. We hope you enjoyed it. We hope you picked up on what we're talking about. Okay, let's go to our questions. This is the People Show, and your questions are the ones we want to ask. Okay. Cindy Hill, my husband has an umbilical hernia, but does not want to go to the doctor. He takes a lot of apple cider vinegar and aspirin for relief. Is that harmful? What's the worst case scenario? Umbilical hernia, that's the belly button, and a hernia is a defect in the wall of the muscle. Now, the six-pack muscles that you have in your abdomen are covered with a covering. It's kind of like saran wrap, and that holds the muscles in a sack. Well, if that ruptures or the muscles split, which can happen as well, then there's nothing separating the skin and the intestines that are inside your abdomen. With the belly button, that's already a point where there's no covering. So if the belly button comes out, you literally, that bulge or the hernia is literally a loop of intestines. It slides in, it slides out, slides in, it slides out. That makes you not as high risk. But what's sliding in and out is a loop of intestines. If it slides out and twists on itself, then you have a bowel obstruction. A bowel obstruction is a medical emergency, and you are in dangerous situation right there on a minute-to-minute basis. The problem is it will start to be uncomfortable. It will be unpleasant. It will hurt. Then it will start hurting like hell, double over. You're in pain. Then it'll stop hurting. You say, oh, well, I guess it got better. Well, what happens is the tissue has tied itself into a knot and cut off circulation. While it was dying and alive, it was hurting. Once it dies, it's pain-free. So you're no longer hurting, which is the main signal that tells you something is wrong, but you're in real trouble now because you got dead tissue that will probably rupture, and you end up with a ruptured bowel, which is life-threatening event. So I tell people nowadays, a hernia repair is such a simple procedure. I don't use the term minor surgery anymore because a patient told me correctly. I was evaluating the patient for a pre-op physical to clear her for surgery. And I said, this is a minor procedure. You go in the morning on Friday, you'll be home by lunchtime. You chill for the weekend, you'll be pretty much back up to speed by Monday. She grabbed my hand, looked me in the eye, and said, Dr. Collier, there's no such thing as minor surgery when you are the person being operated on. I said that was the most profound statement I have ever had. And so I agree with that 100%. If you are the person that's being operated on, no such thing as minor surgery. So I would not say that. I would say that it is a simple procedure now. It can be done almost on an outpatient basis. And when that happens, again, it should not be debilitating in any way. Sometimes they have to put mesh inside to support the tissue so they don't break down again, because oftentimes when the tissue has been challenged like that, it is weak and friable, meaning it'll pull itself apart easily. So they might have to put mesh in there to stabilize the wound. But he can plan to do it. He can say, okay, I'm going to take a day off, go get the surgery, say a Friday, and then take off the weekend and probably pretty much be back to his usual activities by the end of the week, definitely no more than 1 week out, provided, of course, it's not complicated by an obstruction or that the hernia is incarcerated. That means it won't slide back and forth. It's just bulging out. And when that happens, then you have to loosen that up. You have to repair the area. That's a little more extensive. But the good thing is to go get evaluated by a surgeon, have a surgeon on standby. That way, if it ruptures or if you get into trouble, you don't go to the emergency room and just the luck of the draw. Whoever the doctor on call is now your doctor. And he may be the greatest doctor of all time. He may be not the greatest doctor of all time. The main thing is you don't want to meet your doctor on the operating room or in the emergency room about to have surgery. You want to already have established a relationship with him. You want that person to know your chronic disease states, your high blood pressure, your diabetes, know what medications you may or may not be allergic to. All those little things that come together to make a surgical procedure come out great versus when you do things emergently. When you have an emergency circumstance, it may be life-saving, but the outcome is never as good as if it was an elective surgery. So it needs to be seen by a general surgeon. Most of them do it now. They actually even have a few that use this thing called the Da Vinci robot, which will actually, the robot will do the surgery, and the doctor just controls the robot. So again, get that done. Don't wait, because the longer you wait, the more complicated a problem it can be. So the apple cider vinegar does not bother in one way or the other. The aspirin can, because it can irritate the lining of the stomach. The stomach should not be involved in an umbilical hernia, but it could be, depending upon a variety of things and how big your husband's stomach is. So, but the point is, it's unpleasant enough for him to be seeking comfort. And if that is giving him some symptomatic relief, but it's not fixing the problem needs to be addressed. And so tell him that Dr. Collier said he needs to go be seen by his primary care doctor, get a comprehensive evaluation, then refer to a surgeon, because some surgeons you can't go into their office without referral. And it's a process. And then plan on getting the surgery when it's convenient for him to do so, but don't put it off. I tell people planning in a month or two, no more than 3 months might be good. Waiting longer than that, you just keep putting it off. That's not a good way to do it. So handle the business of the business. And Cindy here, take control of your family's health. Most women are the matriarchs of the family's health care. And they control how good or how bad everybody in the household does. So you make sure that your husband is the best that he can be. All right. Hey, Felicia Owens, good evening to you as well. All right. Next question. Laram 85. What can I do for a weak pelvis and perimenopause at 39? I am Renee. One, our doctor's menopausal support would be a great product for you in combination with the lipo hers, because that will improve your libido, make your vagina thick and moist and ready to receive, because physical intercourse is very good to strengthen a weak pelvis. So just the physical activity of having sex make the pelvis tighter. And of course, everybody is aware of Kegel exercises. Kegel exercises are, say for instance, you're urinating and you squeeze your pelvic muscles to stop the urine flow. And so you relax, let more urine out, you squeeze. And you can do that same motion without urinating. While you're sitting there watching television, you can, every time a commercial comes on, you can do a set of 10. And I promise you that will tighten that area up and give it the type of support that it needs so that your sexual activity is more pleasurable. You do not want to have a thin-walled vagina, because it will be easily damaged in the act of intercourse itself. It's not fun. It's not pleasant. It's painful. And if it doesn't hurt during intercourse, then immediately afterwards, or say within the next day or so, you're so sore that you don't want to have sex again for a week or two, because you have to recuperate from it. So the combination of our doctor's menopausal support and the lipo hers, go to the website right now, lipodrops.com. Lipodrops.com, the official website. Don't Google Dr. Collier. Go to lipodrops.com and you will see Dr. Collier pop up, and you'll know you're on the right website. When you do that, take those products. Every day will be better than the previous day. After you've been involved for about 2 weeks, you'll do good. After you've been on them for a month, you'll be doing great, along with the Kegel exercises and increasing the frequency of intercourse to give. It's like working out. It's like going to the gym and working out. Now you're giving your pelvic muscles a workout by having sex, and that's going to increase how well they work. Okay, great, Renee. I appreciate you. Monica Bird, are there any side effects of long-term use of propranolol when taken for anxiety or heart rate? And propranolol can and has been associated with two things that I would call long-term effect. They're not that bad, but they can potentiate weight gain because it slows your metabolism down. So you may put on a pound or two, and it's been associated with depression. So there are other medications. Propranolol is just one of the original medications, and it really is the gold standard in treating and controlling heart rate palpitations or problems associated with cardiac arrhythmias. But there are other choices as well. There are newer, more specific beta blocker class drugs. One is nebivolol or Bistolic. It's a 1 time per day drug. Propranolol can be taken once or twice a day. Nebivolol is a once a day drug, and then carvedilol, which is a twice a day drug as well. Both are more specific for receptors in the heart, so they don't have peripheral effects like some of the others can do, and they may give you some relief. This is not bourbon, unfortunately. I wish it was. This is just iced tea. Dr. Kai is just sipping. Okay, next question. Ms. B. Hi, Dr. Kai. My mom can't sleep at night because she keeps having shooting leg pain. What could help her? Thank you. Okay, sounds like she's got some peripheral vascular disease, so the posture that she sleeps in is very important. Most of us are grown older, sleeping on our sides, and at this point now, your hips and your legs cannot tolerate the weight of the other leg on top of it. So some people try to address this by putting a pillow between the leg that may give some relief, but changing the sleep posture to sleeping flat on the back is probably the best thing. Also, you can have a metabolic abnormality. One of the things that helps if you're having crampy type pain is to take some quinine water. Quinine water is very good. It's the same tonic. You hear gin and tonic, vodka tonic. That Canada Dry quinine water or whatever brand, Seagram's or whatever, it's all in the grocery section. It's $1 or $2 for a big bottle. You can take 4 to 6 ounces of that every night. You can add lemon, you can add lime, you can just drink it straight. It doesn't have a bad taste. And that will help tremendously loosen up muscles and help, particularly if you're having leg cramps. The reason it contains quinine. Quinine used to be available in tablets, and then they stopped making them. And so they really weren't available, and that therapy wasn't available. Much more expensive prescription medications are, but quinine works wonderfully. And it's readily available and cheap, and you can try it to see if you get benefit from it. So 4 to 6 ounces of quinine water every day. I say at least 30 minutes before you get ready to go to sleep. Changing the sleep posture to where she's laying flat on her back, or not flat necessarily. You can prop the bed up. If you have an adjustable bed, just prop it up about 15 degrees. If you don't, 1 pillow in the mid back, 2 pillows behind the head and the neck will prop you up at about 15 degrees. That would allow you to still relax your muscles. And also, when your legs are flat in the bed and you have the cover pulled up, you're extending your toes. The cover is holding your toes down. So when that happens, you get short calf syndrome. So what Dr. Collier does, I put on footies at night, and then I fold the bottom of my sheets forward so that they stop at my ankles and my feet are free and my toes can wiggle. And then that way your calves are not compromised from that way. So all of those things ought to be able to help your mom get a better night's sleep. Check back with us a couple of weeks after she implemented that. Tell her Dr. Collier said, and then she can also replay this show she's not watching right now and get more information. That is our point, infotainment. All right, next question. T. Carter, I'm taking Jardiance 25 milligrams of Mounjaro 2.5 to control my diabetes. I'm not understanding why my A1C levels continues to go up. Two things. One, you have to also, as a part of this, adjust your diet. The A1C tells me what the 90-day average of your blood sugar has been. So it is literally a 3-month look back as to what your blood sugar is and the average blood sugar has been. Oftentimes when Dr. Collier sees a patient, they know they're coming in, know I'm going to do a blood sugar on them. They don't just fast for that day like they're supposed to. They may fast for 2 days so that their sugar will be low. And I do an instant blood sugar analysis, just like you do at home with a finger stick. I say, okay, your blood sugar is this. And they say, wow, my blood sugar is great. See, I'm doing good. Then I get the A1C back, and that tells me the rest of the story. Tells me what they've really been doing for the previous 3 months since the last time I saw them. The Mounjaro 2.5 and the Jardiance 25 is an excellent combination, but you're on the starter dose of Mounjaro. So T. Carter, you're going to have to go up. It goes up to 15 milligrams. You're only on 2.5. So you need to stage that up, and it will get the A1C level down without question. You can titrate up as often as every 2 weeks. The most common titration speed is once a month. So you'll take 2.5 milligram injections for once a week for 4 weeks. Then the next month you go up to 5. Then the next month 7.5. Then 10. Once you're at 10, you may not need to go any higher. Some people do, but it goes up to 15. So that is a great combination. It's one of my most popular ones, and it is one of my most effective ones. So that would be a good way to do it. You just got to hang in there. But also, you really got to make sure the amount of carbs that you're eating is not negatively impacting your diet. So be careful and conscientious. You need to do continuous glucose monitoring. The Dexcon 7 or the Freestyle Libre 3 Plus will be two things I recommend, because then you can see in real time what affects your blood sugar. So you may be eating things you think don't bother it at all, and they may make your blood sugar go up tremendously, and things you think may make your blood sugar go up don't significantly impact it. That is one of the great things about continuous glucose monitoring. This technology, this science, you put a thing that's about the size of a dime on your arm, it measures your blood sugar continuously. You want to know what your sugar is, you just swing your cell phone at it and it lets you know. That alters behavior, and that they have found that by itself, no changes in medications, no changes in anything else, because you learn quickly how your body responds to certain foods. It doesn't matter what Dr. Collier says or how it should respond or how you think it responds. What's important is how it actually does respond, and how it actually does respond will vary. Okay, great question. That is a great question. Okay. How much magnesium is recommended per day, or is it recommended? Magnesium is recommended. It is a great supplement, but it depends on how it is manufactured. So I would say 600 milligrams would be minimum. You can take, some people take 400 2 or 3 times per day. It depends on the manufacturer. So what I recommend is look on the label and see what they say and how to take it, and just take it that way. Then you can get the magnesium levels measured. Next time you go to the doctor, I'd recommend that you get it checked at least every 3 months and take it from there. So that would be great. That would be good. Okay. Benita Pesley. Okay. Would you advise again the best high blood pressure and or diabetes med for black men? Thank you in advance. Okay, I had this question this morning. Was that you this morning, Benita, on Rickey Smiley Morning Show? 2 best medications. One, overall, the first statement I make is the medications that work and lower the blood pressure. 2, to make sure that you don't have any negative effects. The most common that men are concerned about are their blood pressure affecting their libido or their ability to get and maintain an erection. So the 2 drugs that I always start off with, and it will usually take up to at least 3 medications to control your blood pressure, so don't be surprised at that. We learned a long time ago, the original thought process was to give a person 1 medication, increase the dose of that medication to the highest tolerated dose. And if you weren't controlled at that point, like propranolol that we spoke about earlier, then you reluctantly add a second medication. Where we learned that was not smart. What's smart is to use multiple medications at lower doses to decrease the potential for side effects, but to optimize the effect. So you have 1 medication like a calcium channel blocker. What calcium channel blockers do, you have a pipe that's this big, okay? And you take the calcium channel blocker, it makes the pipe bigger. So you have a bigger pipe, same amount of fluid, less pressure. Those pipes are the arteries in your body. So it makes the arteries dilate, open up, they are bigger. And so the amount of fluid, the blood that's in them is under less pressure. Now, the great thing about that is the mechanism of erection is one of blood flow. So you have larger blood vessels in the penis, which means more blood goes to the penis. So you have longer and harder erections. Nobody ever complains about that. I have yet to have anybody say, "Ooh, Dr. Collier, that medicine you gave me, it make it too long and too hard." So nobody ever complains about that. That's a good, if you want to say side effect of that medication, I like to say benefit. And that changes the attitude of a lot of men when I tell them I'm going to put you on blood pressure medication, and they immediately protest. "Won't that mess with your nature, Dr. Collier? I don't want to do anything that's going to give me trouble and problems in the bedroom." Well, this will help with that. Not only that, when your blood pressure is controlled, your body has more energy to do other things like have sex. Your heart pumps like this. It can do this for 120 years. When you have high blood pressure, your heart is going, So that is work. That is exercise, and my arm is getting tired just demonstrating it. When you're using all of that energy just to pump the blood around your body, you don't have a lot of energy left for erections, good sexual activity, or anything else for that matter. You just want to sit around the couch and do as much nothing as possible. So controlling the blood pressure itself will help benefit sexual activity, shortness of breath, activity, and your desire to do other things. Now, the other class of drugs is called angiotensin receptor blockers. These block the effect of a hormone that's secreted by your kidneys that makes your blood pressure go up under stress. So imagine, if you will, this hormone is like a key that has to go into a lock. And when you stick the key in the lock, you twist it, and it turns on high blood pressure. You're cutting on high blood pressure, like cranking the car. You put a key in the car. Well, imagine if you took a toothpick and stuck it in the key hole and broke it off. So now you can't get the key in there. So no matter how many keys you throw at it, you can't get the key in there. So you can't cut on the high blood pressure. So these classes of medication work in a specific way. They do not necessarily bring your blood pressure down. What their primary effect is, stop the blood pressure from going up. This is a very important and significant difference. That way, you don't have a lot of side effects from it, like lightheadedness, dizziness, etc., because it doesn't bring the blood pressure down. It stops the blood pressure from going up. And if you had a normal baseline, then you should have no problems with that. So that is a good problem to have when you're doing that. Okay. So, Dr. Collier, what are your thoughts about losartan for African-American women in particular? I was told that amlodipine was the best for us, but that caused swelling in my legs. That combination of amlodipine and losartan is one of the most common combinations. That is what I just spoke about, a calcium channel blocker and an angiotensin receptor blocker. That combination decreases the swelling caused by the amlodipine, or can be caused by the amlodipine. That's usually at the higher doses. Amlodipine comes in 2.5 milligrams, 5 milligrams, and 10 milligrams. Most people have no problems with swelling at 2.5 to 5 milligrams. It's only when you get to the 10 that it is a problem. And so that swelling usually does not respond to water pills. And people say, can you give me a water pill like hydrochlorothiazide to take the swelling out of my legs? What you want to do is not have the swelling. And that's what the losartan does. It opens up the back end of the pipes so that you're not squeezing blood into small pipes, which is what happens with the amlodipine. So if you take a lower dose of amlodipine in combination with the losartan, I usually will add, there's a combination called losartan HCTZ, hydrochlorothiazide at low dose, 12.5 milligrams. That gives you all of the benefit with none of the potential side effects. Once you get higher than 12.5 milligrams of a diuretic, the next step will be 25, and then 50, you start having concerns about lowering the potassium or spilling potassium. So 12.5 rarely does that. It can do it, but it's highly unusual that it does. But it gives you all the benefits of the diuresis without that. So those two things are good. Okay, great question. Nashni, how can I lower my thyroid peroxidase antibody levels? Nishne, TPO antibodies. That means that there's something of, now the thyroid is becoming an autoimmune issue. You have antibodies in your body that are attacking the thyroid tissue. You can have elevated TPO antibody levels and it does not negatively impact your thyroid, which means you get your thyroid hormone levels checked. You don't just get a TSH, which is thyroid stimulating hormone, which is not even thyroid hormone. That doesn't answer the question. You need a T3 and a T4. T4 is the inactive thyroid hormone that has to be converted to T3, which is the active thyroid hormone. If the T3 and the T4 are normal, it doesn't really matter what the TPO antibody levels are because they're not negatively impacting you for whatever reason. If you get those hormone levels checked and they are abnormal, then you want to try to do something with thyroid peroxidase. But one of the best things you can do, there are three things, all of which are available on our Lipodrops.com website. Omega-3 fish oil, which is a natural anti-inflammatory, and it helps calm down inflammation in the body. Vitamin D3 at 5,000 international units per day. 5,000 international units. This lowers all inflammation in your body. It's another natural anti-inflammatory for the body. And then probiotics. Probiotics seem to help with all allergy responses, autoimmune responses, etc. So our lipobiotic, that combination with the omega-3 fish oil and the vitamin D, those three things are Dr. Collier's trio for good health. I highly recommend that you take each of those every day, regardless of what your TPO antibody levels are, any other health issue that you have, that will calm it down. I can promise you, if you start taking the probiotic, the omega-3 fish oil, and the vitamin D, and check your TPO levels in a month, those numbers will be dramatically decreased. But it's important that you also check a full thyroid panel to make sure that it's not negatively impacting your thyroid health. Because if that is the case, and let's say it can do two things. It can cause low thyroid, it can cause high thyroid. If it's causing high thyroid, that's a real issue because all the medications that are used to treat that have a lot of side effects. If it's causing low thyroid, then you give thyroid replacement, but you are just covering up the problem. You're not fixing it. That's not a solution. It's just controlling the symptoms, and it will require higher and higher doses over time. So the objective is to decrease the TPO antibodies. And to do that, like I said, those three things in combination, which are all perfectly natural, all complementary to any other particular medications you may be taking for any other disease state, high blood pressure, diabetes, thyroid disease, one or the other. None of that matters. You can still take those three things, and that will give you great benefits. So great question, Miss Nashni. Okay, Miss Makiba Bowler, Lipo T available on Lipodrops.com. Yes, ma'am, it is. But for women, it's the Lipo Hers. Lipo Hers for the women, Lipo T for the men. So, Miss Makiba Bowler, that's your question. Okay, Valerie Williams, why shouldn't women use Vaseline as a lubricant? Valerie, I am so glad you asked that question because last time on our Sex in the 50 segment, Sex in the 50, we talked about, a lot of the old school, those that grew up in their 50s and 60s even now, they would have that nursery size jar of Vaseline on the nightstand. And they just get a gob of that and they lube up the penis and or the vagina or both. Well, that lubricant is petroleum based. And one, petroleum is what's in gasoline. It's like fire. And so it is very, very insulting to the vaginal mucosa. So it's slippery and it stays there because a man can get up and wash it off and it's not a problem. Plus, it's not getting on his mucosa. The skin on the penis is just like the skin on the rest of the body. It is impervious to the Vaseline. But pink and moist inside your nose, inside your mouth, where things are pink and moist, that is a mucosal area. That is what the inside of the vagina is like. It does not like Vaseline. And you can't get it out of there. So it will stick to the lining of the vagina. It will cause you to have excess secretions, which usually will result in, at minimum, a yeast infection, but also a high incidence of bacterial vaginosis because the bacteria is stuck there in the Vaseline as well. So it can thrive in that environment. So you end up with a yeast infection and a bacterial vaginosis. And you always have probably UTIs as well. You probably always have to go to the doctor because these things are recurring. And that is the reason that they're recurring, but you have not had that conversation with the doctor as to possible reasons that could be. So water-based lubricants like KY jelly or liquid. The KY comes in a liquid now. It comes in the size like an eyedropper, like Vaseline, about that same size. Just a few drops of that. Very slippery, and it literally will wash itself away, or you can wash it away because it's water/aqueous based, and it is perfectly safe inside the vagina. Another is AskDrLube. AskDrLube is very good, particularly if you're trying something different. You know what I mean? So it's good for any portal that you're utilizing that needs to be lubricated. The AskDrLube is very good for that, and it is non-irritating. It's easy to clean up, and it washes away, and your body will tolerate it quite well. Carolyn Cooper just spoke with my friends, and she's been on her blood pressure medicine since Friday. Losartan, I think. Should she be having side effects already? She's having a problem getting it to the. She shouldn't be having side effects, particularly from that medication. There are no side effects, unfortunately, unless you're allergic to the molecule proper. And now some 2% of people may have an allergic reaction to it, but 99% of people do not. 98 to 99%. But if it's 1% and it's it's 100%. So anytime a person thinks they're having a side effect to a medication, they need to have a conversation with the doctor that wrote that prescription, let them know what's happening and see if there's a problem. And so that should be it. Okay, great question. Super cool. Doctor, can I ever get off blood thinners? Had blood clots in 2022, was told that I would have a 10% chance of having another without taking Eliquis. If you've been on blood thinners for 2022, now you're almost 3 years in, I would say I would give it at least another year, maybe 2. 2025, I think about trying to come off of them. If you ever come off of them and you do have another blood clot for whatever reason, then you're on blood thinners for the duration. The great thing about Eliquis is it works and you don't have to monitor blood results like you do when you're on the first line blood thinner, warfarin or Coumadin. That requires you to go into the doctor's office very often, weekly in some cases. Most of people at least once a month to get your blood clotting factors changed, and it is very susceptible to diet. What you're eating, what you're not eating, how hydrated you are, whether you're drinking enough water, whether you're drinking alcohol, all of those things, Coumadin is affected by. Eliquis doesn't have to be monitored. You don't have to worry about any of that. It worked amazingly well. The problem is it is one of the most expensive drugs on the planet. Fortunately, most insurance companies do cover it, but insurance companies are pulling back tremendously now. Some have stopped covering it, and they want you to go back to the first generation, which is a medication called clopidogrel or Plavix. 75 milligrams, one tablet, one time per day. The Eliquis is a 2-time per day drug. So there are options as well. So if the cost is the issue and not the medication itself, but if you're on the medication, you need to make sure you're taking something to protect the lining of your stomach. That would be famotidine, Pepcid, or omeprazole, an H2 blocker, or a proton pump inhibitor, because GI bleeding is one of the major side effects of a blood thinner. But also, when you have a blood thinner, you're susceptible to things like if you hit your head, bleeding inside your head, or if you just bump your elbow or your leg, you can bleed because you don't clot. That's the whole point of taking the anti-clotting medication. The objective is that if you're taking it for clots, or if you have atrial fibrillation, that prevents you from having a heart attack or a stroke. So doctor did tell you that 10% is a low percentage. I would go with that in the casino every time. But again, if you're not having any side effects, I try it for at least another year. And then after that, consider coming off of it. But if you come off of it and you have another clot anywhere at any time, then you're going to be on it. You're going to be on it or something like it for the rest of your life, because there's no benefit to having a clot. The clot comes in your leg, it breaks off, goes to your heart and to your lungs. That's called a pulmonary embolism. Smaller clots that go into the heart can cause a heart attack, or your heart can pump a small clot up to the brain, cut off the blood flow, and then you have a stroke. So all of those are the things you're trying to avoid. And all of those sequelae of clotting, heart attack, strokes, and pulmonary embolisms are not, they're all life-threatening events. You don't want to be at risk because you didn't want to take the pill, particularly if you're not having any problems with it. Now, if you're having problems with it, that's another question. It's something else that needs to be discussed. All right, Dewana Robinson, I heard you speak of a certain amount of vitamin D today. Can you go back over that, please? A normal vitamin D level is 30 to 90. You would like for your level to be at least 40. With a vitamin D level of 40, you have strong bones, you have strong teeth, you have healthy skin, you have healthy hair. Most importantly, your immune system function is optimized, and you are less susceptible to viral infections like the flu and the coronavirus, bacterial infections like strep throat and pneumonia, fungal infections like fingernail fungus, toenail fungus, jock itch, and vaginal yeast. So very important that you get that level up to 40. Scientific studies have shown if you get that level over 60, then it's cancer prevention. Multiple types of cancers, breast cancer, colon cancer, pancreatic cancer, all respond to vitamin D prophylactic therapy. When a person is diagnosed with any type of cancer, the first thing they do before they talk about chemotherapy, radiation, or whatever, is to place the person on vitamin D therapy. That vitamin D therapy, again, has to be at a therapeutic dose. The biggest problem with vitamin D is, one, everybody has low vitamin D now for some reason. Don't know whether it's something in the environment, something in the food chain. We get enough sun exposure. I live in Atlanta in the South. There's enough sun driving my car back and forth to work. So I don't, that's enough sun exposure, and we make vitamin D from sun exposure. But I'll say more than 90% of my patients that come in have not just low, but extraordinarily low vitamin D. So there's a reason for that. We just don't know what that reason is. But what I do know is that the most common over-the-counter dose for vitamin D, and the doctor says, oh, you got low vitamin D, just go get some at the drugstore or Kroger or Publix or some other place, is 1,000 milligrams. The unit of measure is international units, IUs. 1,000 IUs is a totally complete waste of time. The therapeutic dose, one that gives you all the benefits that we mentioned, is 5,000 international units. That is more difficult to capture, but now is available. It used to be, you had to go to a specialty store, like a health food store or a vitamin shop or a GNC to get 5,000 international units. Now it's available on Lipodrops.com. Go to Lipodrops.com. Our Doctor's D product with 5,000 international units is a small, tiny capsule. It's crystal clear, and it has pure vitamin D3, the active vitamin D. It comes in vitamin D2 as well. D2 has to be converted to D3. Some people do that very effectively. Some people do it very efficiently. Some people do it, but they don't do it efficiently, but they do it. Other people don't do it at all. So they're taking vitamin D2 and not getting any benefit from it. What's important is that you cut out the middleman. Just get the D3. So you want vitamin D3 at 5,000 international units per day. You can get it on Lipodrops.com right now. Go to there and you can take it. You take it every day. The biggest problem is you have it. It's sitting on the counter. You take it when you think about it. Keep it by your toothbrush. You wake up in the morning, wash your face, brush your teeth, take the pill. That way you got it out of the way. You've taken it and you'll find, because vitamin D is the body's natural anti-inflammatory, you will have strong bones, strong teeth, healthy skin, healthy hair. But more importantly, a lot of inflammatory conditions that you may feel but don't see, like arthritis, heart disease, cardiovascular disease. All these things benefit greatly from having good therapeutic vitamin D levels. So that's where we are with that. Great question. Crafty Cover, I have arthritis and DDD. That's degenerative disc disease. That's affecting the neck and back. It could be the neck. It could be the middle of the back, what's called the thoracic spine. It can be the lower back, which is called the lumbar sacral spine. So any of those things are things that we have to be concerned about with this disease. I took meloxicam, which is an anti-inflammatory in what's called the COX-2 category. So you have anti-inflammatories that are NSAIDs that are like naproxen, Motrin, Advil, Aleve, ibuprofen. All of those are the most common familiar ones. But then they developed the COX-2 because they were easier on the stomach and very effective on the cellular level. The two most common are Celebrex or Cephaloxivir and Mobic or Meloxicam. I took it for several years, and now I'm on diclofenac, which is Voltaren or something like that. But I'm still stiff when I get up and still hurt when I walk or stand for so long. Hell, okay, they switched you from the Meloxicam to the diclofenac because you were, I guess, progressing your disease state, more inflammation. So a couple of things. Next time you go to the doctor, make sure they're checking your C-reactive protein, CRP, and the high sensitivity C-reactive protein, and the sedimentation rate. Those are two inflammatory markers that will state how much inflammation you have in your body, and you can monitor those things. Guess what? You have high inflammatory markers, you take vitamin D, and the inflammation decreases. So two things I would definitely add to your treatment regimen that will be life-changing: omega-3 fish oil and vitamin D at 5,000 international units per day. Same thing we talked about dosing-wise, a therapeutic dose of omega-3 fish oil. The most common over-the-counter dose that's available is 1,000 milligrams. Most people take 2 of them. You need to take at least 4 of them. Now, that is a substantial and significant pill burden, particularly if you're taking other medications. 4 additional pills a day is hard to take. Now, our vitamin D is 1,480 milligrams per capsule. You take 1 in the morning, 1 in the evening, you're getting a therapeutic dose, and you're getting all the benefits from the vitamin D without having to worry, from the omega-3 fish oil, without having to worry about taking 4 a day. So it's important that you take enough to get the job done. So if you add the vitamin D and the omega-3 fish oil to your therapeutic regimen, that will be our Doctor's D and our Lipo Omega, available on the Lipodrops.com website. After you've been taking them for a couple of weeks, you'll notice a major difference. After you've taken them for a month or so, it will be life-changing. So I would still take an anti-inflammatory. The Meloxicam is good because 1, it's once a day. 2, it's very easy on the stomach. Diclofenac or Voltaren, the long-acting version, it comes in 50 milligrams and 75 milligram tablets. Take the 50 milligram, you need to be taking it every 8 hours or 3 times per day. The 75 milligram tablet is twice daily. Now, there are 2 types. One that is enteric coated so that it is not dissolved in the stomach, so it doesn't irritate the stomach. It's not dissolved until it's out of the stomach into the small intestine, the first portion of the small intestine. So it decreases the challenge and insult to the gastric mucosa, the lining of the stomach. And so that makes it less ulcerogenic. But the Meloxicam is minimally ulcerogenic. So very good that you would take that. But regardless of any anti-inflammatory that you're taking long-term, you would benefit from taking an H2 blocker like famotidine, Pepcid, which is over the counter, but you also can get a prescription. Prescription strength dose is 14 milligrams. Over the counter is 20 milligrams. So you could take 2 of them if you wanted to. You can probably find those products at the store where everything's $1.25 now. And so I highly recommend that you pick up supplements like that. But for the omega-3 fish oil, you want a good product. Our Lipo Omega is excellent, 1,480 milligrams. That is unique in the industry. There's nobody else that has that. So this is the only place you can get it, lipodrops.com. And then the vitamin D, Doctor's D at 5,000 international units per day. This is not going to be take 1 pill and quick fix. But once you start taking that regimen, you will notice a marked improvement in the amount of inflammation, ergo the amount of arthritis pain that you're having. Great question, Crafty Cover. Felicia Owens, I want to know, what can I take for gas passing? I pass gas when I'm just about walking. It's insane. Okay, Felicia, you have a problem with your gastric biome, the bacteria that's in your gut. It's predominantly aerobic bacteria, which is the bad kind of bacteria, which not only makes a lot of gas, but it makes the foul smelling gas as well. And so, it's, when you pass gas, you're just walking. You also got that walk by air that people are well aware of you. So you'll smell like that for a minute or two just from passing the gas. If you got on tight clothes or underwear that can't air itself out, you may smell like that for even longer. So how do we fix that? 1, probiotics. probiotics. Our probiotic formulation, the lipobiotic, is the absolute best thing that you could do. You would also benefit from my lipo cleanse product. Understand this: the GI tract is one space. Your mouth, your esophagus, your stomach, your small intestines, your large intestines, your sigmoid colon, and your rectum. It is literally one long tube. The name changes to protect the innocent. There are a few valves in certain places to stop backflow, if you will. There's a valve at the junction of the stomach, that at the bottom of your esophagus before you go into your stomach, called a hiatus. There's a valve there. And there's a valve going into the small intestines. There's a valve going to the large intestines. So the gas should be flowing one way. But if the bad bacteria is in there baking, imagine, if you will, if you had food at the end of the day, you got garbage. You put it outside in the garbage can. It's 98 degrees outside. It's hot, and the garbage is not going to be picked up for a week. Well, that starts to fester and become very foul. Well, that's what's happening inside your gut. Your body temperature averaging 98.6 degrees. It's inside the gut at a perfectly good temperature for spoilage. And that's exactly what happens. The food starts to spoil, the bad bacteria overgrows, and now you're having that problem. You can even start to burp as well. And your burp is foul, just like passing gas, farting, if you will. It won't smell any differently. And it has nothing to do with brushing your teeth or anything like that. Just your entire GI tract is foul. So lipo cleanse, which will help you move the bad stuff out. And then the lipobiotics, which will change the gut biome to healthy, good bacteria. Now, so you have less gas, probably a minimal gas, but also even when you do pass, it won't be as foul. It will be, I won't say it'll be fragrant, but you'll be proud of it versus shying away from it. Okay, Felicia, great question. Arnita Juden, what to take for mucus in the body? Well, Anita, again, I think probiotics are very good because they cut down on the body's allergy response. A lot of mucus, for whatever reason, as we age, we make more mucus, and we wake up in the morning, we got you get in the shower, you got to clear your chest. Finally, after about an hour, even just standing up, mucus now goes down. That was when you lie down, it's up getting to your middle of your chest and your upper chest, and then your sinuses as well. Sinuses, throat, there's mucus everywhere. Mucus has a function, that function being to trap dust, dirt, bacteria, and viruses and keep you healthy. The problem is excess mucus production can be obstructing. It can alter your voice. It can cause difficulty breathing out of your nose. Again, chest congestion with a chronic cough that may be productive or may not be productive depending upon how deeply you cough and how much enthusiasm you use to get it up. So, addition to the probiotics that I mentioned earlier, two things to cut those, that cuts down on the allergy response. Two things that you can take to stop allergy response: non-sedating antihistamines like Allegra, Zyrtec, Zysol, or Claritin. Allegra, Claritin, Zyrtec, Zysol, all of those non-sedating antihistamines. The classic antihistamine is Benadryl, but Benadryl is highly sedating. So most people cannot take it. Plus, it only lasts about 4 hours. So 6 at the most. So it means you got to take multiple doses to get through the day. You take it in the morning, you're good for 4 or 5 hours. By lunchtime, you're snotting again. But the non-sedating antihistamines are very, very effective in doing so. If you find that you have more upper airway mucus, like in your nose and your sinuses, then a nasal spray such as Flonase or Nasacort, very good for that. Dr. Collier was not a big proponent of steroid nasal sprays, but they work amazingly well. So sometimes I will have to use both. I use a nasal spray when I'm flaring up, if you will, as well as a non-sedating antihistamine. And then again, but once I started taking the probiotics, then I found that the need to do that was minimized. But there are occasions you get exposed to various things that sensitize you. Once you are sensitized from the allergy perspective, you'll always be sensitized. And then things that didn't bother you at all now can bother you, or things that were minimally irritating to you now cause major allergy responses. So once you're sensitized, your body is ready to have an allergy reaction at any moment. So you got to be very careful about that. So I have to take an antihistamine on a daily basis. So it's part of my morning regimen. I wake up, wash my face, brush my teeth. I take my doctor's trio. That's omega-3 fish oil, the vitamin D, and the probiotics. And then I take a non-sedating antihistamine Currently, I'm taking the 5 milligrams of levocetirizine, which is Xyzal. It's the most potent product on the market, but I also like Allegra. Again, I like all of them. Everybody has one that they think is their favorite or they think works best in them. So, you can get variations of all of these, again, at the store where everything's $1.25. And so get one, try it, see which one works best for you. But just remember, they have to be taken almost on a daily basis to keep that mucus under control. All right, great question. Kim Jenkins, what can I do to reduce the protein in my urine? Protein in the urine is a sign or signal of damage to the kidneys. Normally, your kidneys are basically like filters. So imagine, if you will, back in the day when you went to grandmother's house, she didn't have air conditioning. She had what we call a screen door. So you opened up the main door, you had a screen door with a little hook on it. The screen door was fine. It kept out the bugs, kept out the mosquitoes, no problems. Until you got over there as a bad little kid, and for whatever reason, kids will always take either a finger or a pencil and push it through the screen door hole. So the tiny little holes that were part of the screen door that blocked and kept out everything now are big pencil-sized holes that allow bugs and mosquitoes and everything else to come back and forth, flies and all those bad things. Well, your kidneys are the exact same way. You imagine them as being a filter or a screen, and high blood pressure, the most common culprit, but also diabetes, pounding. High blood pressure pounds until it creates holes in the screens. And protein molecules that normally are filtered in the kidney but reabsorbed, they just go through the kidney but don't come out. So the protein stays in your body. Well, when you have proteinuria or protein in your urine, that means that there's breakdown on the cellular level of the kidney structure proper. They have been damaged by either blood pressure or diabetes, and now you're spilling protein in the urine. Now, you should have no protein in the urine, but an acceptable amount, you measure these things on a scale of 0 to 4 plus. An acceptable amount would be 1 plus. 2 plus is pushing it. Once you're at 3 or 4 plus, you got some substantive and significant kidney damage that needs to be evaluated. But the main treatment is fixing the disease process that's causing the proteinuria. That's the high blood pressure and the diabetes. Fortunately, most of the treatments now, the newer treatments for particularly the diabetes, have major benefit on kidney health as well. So they help cut down on the proteinuria. I'm talking about the SGLT2 inhibitors, that would be Farxiga and Jardiance, or even the shots, the Ozempic and Mounjaro shots, the GLP-1s. They help tremendously with kidney function. They also help prevent inflammation and prevent and decrease heart attacks and strokes. So a lot of the side benefits, besides controlling the blood sugar and besides making you lose weight, they do great things as well. Great question, Kim. Marie Morgan, I bought your Lipo Cleanse a week ago, but haven't started yet. Does it make your bowels move? The Lipo Cleanse is not a laxative. I have to explain that to people. It does not give you uncontrolled diarrhea. It does not give you abdominal cramping. What it does do is give you large, easy to pass stools that when you do go, you will have larger stool than you have imagined. And once you start going, you'll keep going. And if whatever your average stool was, the frequency would probably double. So if you were going once every other day, you'll be going every day. If you're going once a day, you may be going twice a day. But the Lipo Cleanse is an amazing product. The other thing is the caveat. You have to make sure you're drinking enough water, because if you're not drinking enough water, Lipo Cleanse, because it is a fiber containing product, can create more of a problem. You'll get more fiber in there. It makes the stool more difficult to pass. So the fiber works wonderfully as long as it is hydrated and you got enough fluid in there to keep it moving forward. So I tell patients oftentimes, if you've really been having difficulty with bowel, take a laxative first, or a cleanse that will move your bowels, that stimulates your gut. And then once your gut is empty, you start off, you're new with the probiotics and the Lipo Cleanse, and your GI health will be established and maintained. All right, Ray Willis, I think I have the wrong BD. They are not the small ones. I have some white capsules. Okay, I think the wrong vitamin D. Okay, yeah, the vitamin D we have are small, round, yellow caplets. They're clear. You can do that. Should be it. So if you have the Doctor's D product, we need to see that and talk about it. Kelly Nelson, what is the best over-the-counter appetite suppressant? I'm not aware of any over-the-counter appetite suppressants other than fiber-type products that can do that. That would be Metamucil, that would be FiberCon, things like that. Our Lipo Cleanse is a great product for that as well. The appetite suppressants proper that work are all prescription. The most common is phentermine. Decreases the appetite in an amazing way, and I use it in my weight loss clinic because it helps decrease your appetite. It helps you lose weight, and so that is a great way to do it. But 2, the entire lipo line will give you what you need. Kylie, you need to go on the website lipodrops.com, see what your objective is, how much you want to lose, how quickly you want to lose it, and what are the problems you're having losing it. And then it will direct you to different products that will give you the outcome that you like. And so that will be safe. It is over the counter, and you can get it and order it, and you'll get great benefit and accomplish your objective of decreasing your appetite and making you lose weight. Okay, that was our final question, Heilig. And we are so grateful to each and every one of you who have tuned in today. We appreciate bringing you infotainment, medical information that you can share with your family and your friends. We want to make sure that you are doing what you want to do. So thank you for joining us today on the Ask Dr. MJ. Why? Because your health is important. Facebook Live, Instagram Live, YouTube Live broadcast, the only interactive healthcare forum that allows you, the listener, to call in, sign in, and ask your healthcare questions. So we are so glad that you tuned in. Val, I see you saying thank you, Val. We appreciate you for being a regular. And we want to make sure you tell all your friends. Don't keep this a secret. Tell all your friends to go to my YouTube channel and subscribe. It doesn't cost you anything. You can subscribe to the YouTube channel. You can also do that by going to the Lipodrops website, lipodrops.com, and you can sign in. There's a direct link. And not only is this information readily available because it is archived and replayed in their videos on hundreds of topics on virtually any healthcare question that you may have, or something that you heard me say on this show or on the Rickey Smiley Morning Show, where I do Wellness Wednesdays every Wednesday at 8:20 a.m. Eastern Standard Time. We go from 8:20 to 9 a.m. where you can call in and ask your questions there as well. And so we start off with giving you great information, and then we go to the callers. So you can call in right now. So Luana, thank you. Marie Morgan, thank you. Angel Hanji, thank you. I hope you enjoyed it, and I'm glad that you did. Deborah Williams, thank you as well. Thank you, Heilig, for a great show. Thank you for screening the calls and being the world's best producer and call screener. You make this show what it is, and we are so glad to have you here. Thank you so much. Next time, we're going to have Sex in the Fitty. Again, Sex in the Fitty. Look forward to it. We're going to talk about best ways to enhance your love life when you're 50 and older. Be there. We look forward to seeing you. Once again, Dr. MJ Collier. And we are out. Oh, he got